off to the side, you can prepare your trunk muscles. This is the spine twist. You can slowly turn to one side using your inhalations and the exhalations. When you turn to the side, that is the exhalation. Once you come forward, it is the inhalation. From the inhalation, you are turning to the next side during exhalation. If you feel comfortable during that turn, you can stay there. After a comfortable stay, you can slowly turn again forward. In the same way, now we can go for a lateral bending, a side bending with the straight hands towards the left and the right. You can go for lateral bending, the side bending. This practice resembles the famous yogasana called the Ardhakati Chakrasana. With this, you can prepare your side muscles. The muscles on your sides is well prepared for practicing of any yogasana. You can do the same practice on the other side also by raising the other arm. Don't make any part of the body stiff. Without stiffness, you have to move your arms. Don't tighten any of your muscles. Have a flexible body. Have a gentle bending. The degree of bending is always up to you. To whatever comfortable range that you can bend to the side, you have to decide. Now, after this lateral bending, we will go for the trunk rotations, rotating the trunk so that all the muscles around the abdomen and around the pelvic are prepared. Push your body to the side, forward, and to the next side, and also backwards. Right, front, left, backwards. In the same way, in the opposite direction also you can do the rotation, left, front, right, and back. As many rounds as you can, but be comfortable during this rotation. You should not lose the balance of your standing. Then now we will go for, after the relaxation, we will go for the next practice, that is leg rotation, rotating the leg. Begin the rotation of the leg. You raise one leg, and keep the leg as straight as possible. You should avoid a bend near your knee. The rotation can be in clockwise and anti-clockwise directions. You can have the same practice with leg folded. Try to have a gentle bend at your knee and achieve the ankle rotations. The ankle rotations can also be done in clockwise and anti-clockwise directions. After a few rounds of practice, you can bring the leg down. Then you have to perform the same practice on the other leg. If you need any relaxation during any practice, it is up to you to decide the relaxations. Relax for some time, then go in for the rise of the next leg. Stand comfortably, rise the other leg, keep the leg straight. Feel all the muscles on your leg, especially the muscles at your thighs, you have to feel. You can rise the muscle upwards as up as you can, but don't force. A forceful practice has to be avoided. Never go beyond your comfortable range. Yes, you have now prepared your ankles. This helps for a proper standing for a pregnant woman. Relax. After the relaxation, now you can go for again the leg rising sideways. You just raise one of your legs to one side. You can rise as much as you can, but it depends on your comfort range. Then bring the leg back. Prepare yourself to raise the other leg. Be properly stood on your one leg. Take care that you have in your balance. You are in a well balanced state. In this way, you can repeat the same practice. You can repeat this practice as many times as you like and as long as you are comfortable with that practice. Now we will go on to the next practice, a walking practice, to walk on a spot. It's called spot walking. The person before you is in her pregnancy in the last trimester. It is not so easy to raise the leg in a straight way, so she has opted to raise her leg in sideways. The comfort depends on the person. If you feel comfortable raising your leg in a side way, you can go for that. If you can raise your leg in a straight way, you can go for that also. But during the last trimester of the pregnancy, it is advised to raise the leg in sideways. Anyway, don't force yourself to have more practices. Have a comfortable practice. Find your comfort range again and again. Relax. To prepare the whole body, you need to prepare the whole body step by step. Now we will move on to practice of some of the yogasanas which are helpful during pregnancy. A pregnant woman, especially during her third trimester, last trimester, during her last period of the pregnancy, can comfortably practice vertical postures, which leads to vertical stretch of all muscles of the body. One of the famous asanas in the vertical posture, in the standing posture, is the Tadasana, to stand firm like a tree. There are so many variations. One of the variations is now shown to you. The arms are rising upwards, and slowly the arms are raised again upwards. This is called Tadasana. Stretch your arms, stretch your shoulders, stretch your muscles on your back, your abdomen, and have a comfortable posture. Stay in the posture. During this stay, try to have deep breaths, deep inhalations and slow exhalations. Have a rhythmic breathing. You can stand like that for a comfortable time. Then you can release the posture, release the stretch of your arms. Then slowly bring your arms down to shoulder level. Being at the shoulder level, slowly turn your hands downwards. Then again bring your arms down. If you need any relaxation, you can relax. This is one of the variations of Tadasana. You can go for many more variations in the Tadasana, but depends on your comforts. Now we will go on to the lateral bending again. This famous posture is called Ardha Kati Chakrasana, the half wheel posture. You are raising one of your arms to the side, then slowly bending to the other side. Raise your arm to the shoulder level, then turn your hand upwards, then raise your arm again. Once you reach the vertical state of the arm, stretch. Your shoulder muscle has to reach your ears. In such a way you have to stretch. Try to keep the other hand as straight as possible. Have normal breathings. Try to have deep inhalations and exhalations. Have a bend to the other side. As you bend, you will feel a proper stretch of your side muscles. Since the left arm is downwards, the fingers of the left arm are moving below the knee. It indicates a proper stretch of muscles on your side. The muscles on the right side are stretching to assume the proper blood circulation. Now slowly rise, release from the posture, have normal breathing, then bring your arm down to the shoulder level. At the shoulder level, turn your hand downwards and again bring your arm down. If you need any relaxation, you can have the relaxation, otherwise you can go for the bending of the other side. You can rise now your left arm to the shoulder level. At the shoulder level, turn your hand upwards and again raise your arm upwards. Now try to stretch the shoulder muscle towards the ear. Try to keep the head straight. Once you assume the stretch of the muscles of the body, of all muscles of the body, then you start bending to the right side to feel the extension of stretch of muscles on this side, on the left side. Now naturally, the fingertips of the right hand are below the knee level. Try to have a rhythmic breathing during this posture. You can stay for a comfortable time. Now slowly you can release. And you can slowly and gradually bring your arm down, then relax. Now we will move on to a next posture, a legs apart posture called the trikonasana. Here the body looks like a triangle. The legs are taken apart. This also helps for the stretch of muscles on the sides. Okay, now you are bending to one side by raising your arm. Trikonasana, the triangle posture. Now she is bending to left side in order to prepare the muscles on the right side. The right arm is stretched upwards. If possible, you can see upwards, but take care, find your comfort range. Don't bend forward. If you do so, you are putting more weight on your abdomen. It is not recommended to do so. You can release.